Greetings, everyone. My name is Johnny Cornegay, and advocating for HIV criminal law reform is an important part of the work that we do here at CNP. Here's a quick look at some of the work that we've done over the years. At CNP, we recognize that changing hearts and minds is critical to changing of policies and making lives for Black, gay, and queer men better. That's why shifting the narrative is so key to all of our work. It's been true from the very beginning. CNP stands on the shoulders of activists and strategists like Bayard Rustin and Craig G. Harris, as well as artists like Marlon Riggs, Essex Hemphill, and James Baldwin. HIV decriminalization is critical to ending the HIV epidemic, and we have incorporated this messaging into our work in many ways. In 2013, CNP hadn't yet been formed, and Michael Johnson was a student athlete at Lindenwold University in St. Charles, Missouri. He was a respected wrestler at the school, and he aspired to one day compete in the Olympics. Michael's dreams were shattered when, in October of that year, he was arrested for having consensual sex while living with a manageable, treatable condition, HIV. The link to Michael's story is in the description. CNP launched the hashtag Free Black Gay Men to raise awareness about Michael's case. 89 Black gay men signed an open letter to Michael that opened with the words, "We, Black gay men, write this letter to you out of love. We can only imagine the burdens that you have had to carry personally. Experiences of isolation, shame, rejection, and moral judgment. But we want you to know that in our lives, we have had to carry those burdens as well." You see, to us, decriminalizing HIV is not just our responsibility, it's an active expression of love to our community. No one should ever have to endure what Michael and many others have. On our PAS award-winning program, Revolutionary Health, Robert Suttle, who has also been impacted by HIV criminal laws, joined us on several occasions to advocate for HIV decriminalization.
I think it's definitely important for people to share their stories. We need to continue to tell our stories because the narrative has already gone out. You know, either years before some people may have contracted HIV, like for those of us today, I know we have a lot of long-term survivors, but even for myself, the narrative was already out there that that I'm a criminal, that I'm a dangerous person, even before I ever contracted HIV and even faced prosecution. So I say that to say I'm very passionate about storytelling as a strategy. Because people need to know, people who are not Black and brown need to know what we are experiencing, because they're not going to talk about it. And whenever other people that are in power talk about it, it's always about protecting the public, protecting people, but they're not really hearing and understanding the stories of people that are going through it. And so they may not want to hear about a sex worker. They may not want to hear about an injecting drug user. They may not even want to hear about gay people, but we have to keep telling our stories.
Our digital publication, The Reckoning, focuses on thought-provoking articles about the Black LGBTQ community in Atlanta. Stories about HIV, and in particular HIV decriminalization, have been part of our writing there. Contributor Craig Washington wrote an amazing piece called Weaponizing My Sex: How a Consensual Encounter Flirted with a Felony. In that article, Craig writes, "The most insidious mistruth about HIV criminalization is its purported purpose as a fair-minded HIV prevention tool. The continued enforcement of HIV criminalization across the U.S. is not driven by a thoughtful, compassionate response to ending AIDS. Treating HIV-positive individuals as criminals for not disclosing their HIV status to their sex partners has never been shown to curb infection. The measure is not only ineffective, it is as irrational as the animus targeted towards gay men, cis and transgender women, Black and Latino people, and people who use injection drugs that motivated this approach." We won't stop, and we are committed to engaging with the issue of HIV decriminalization on multiple fronts. On CNP TV, we invited Black lawyers Linda Dixon, Eric Polk, and Mandisa Moore O'Neill to talk about the overlapping issues of HIV criminalization and COVID-19. Here's Eric and Mandisa weighing in on the issue.
So for us to be having conversations, whether it be about COVID-19 or about HIV criminalization, and for race not to be like at the top of the list for where the conversation starts, I think is very dishonest.
I totally agree. And to me, like historically and currently, there has never been a conversation on criminalization that did not impact Black people. Like, if we're talking about, like, I know in a lot of Southern states, ours included, especially last year, it was all of these anti abortion bills introduced, mostly passed and signed into law. That's a criminalization conversation that needs to have Black people. And it's like, there's no example of criminalization that's not already having an impact and stands to further impact our community. And that's one of the things that I see, like this paradigm that we're in terms of, we see examples of people wearing masks, Black people wearing masks being criminalized. We see examples of Black people not wearing masks and being criminalized. So it's very clear that the conversation is not about public health, because how is it in the interest of public health to have 5 officers tackling somebody not wearing a mask if it's really about contagion and containing and flattening a curve? We see how, once again, public health is being used as this kind of framework to really increase the policing of our communities and their surveillance.
We have done a lot over the years, and this is just a sample. Have you incorporated some of these tactics into your advocacy toolbox? Definitely let us know down in the comments. CNP believes that HIV criminalization laws demand reform. We are part of the Health Not Prisons Collective. To learn more about the work that we do around HIV decriminalization, visit bit.ly/CNPHNP. Oh, and get involved in your state's efforts to decriminalize HIV. They can use your support. Peace.